Good afternoon, evening, Dr. Deuk Majin, and we are preparing to perform the Deuk laser disc repair on a thoracic disc herniation for a patient who has thoracic pain. It radiates around his rib on the right side. And his disc herniation is small. It was missed by the radiologist, but he has pain localized to this area, and he has facet joint pain as well. We actually blocked the facet joints and it took a lot of the pain away, but it didn't take the radicular pain, which we believe is coming from his disc. All right, T9-T10, everybody in agreement? Right side, this is the right side. Patient is asleep. He's laying on his belly, and I'm going to go ahead and get started. This is a thoracic Deuk laser disc repair, and it'd be nice if we could. I mean, let's see if you're comfortable with it. Yes, if not, but I'd like to try to do a discogram. Shot. All right, so you can see the 12 rib, 11, 10, 9. So there's the 10-9 disc. Yes, and we're headed right towards it. Let's see what we can do here. Shot. Let's get a lateral view. So it looks like we're headed in the right direction, and we're going to check our view on the lateral x-ray just to see where we are. All right. So there it looks like a rib there. Where do you think 12 is? Jordan? You think that's 12, huh? Looks like there's a rib coming off of it, right? 12, 11, 10, 9. So we need to aim down a little bit. See if we can get down there to 9, 10. Shot. That's too low. See 12, 11, 9, 10. Shot. It's not too bad. I think we're medial. Shot. All right, so let's go back to an AP. I'm just going to talk a little bit as I work, but we're going from the right side because he has right-sided pain. Yeah, we're too medial, so I need to be a little bit more lateral. And I like to err on the medial side. That's the safe side. Lateral view, please. 12, 11, 10. It looks like we're headed right to the 9-10. So far, so good. Huh? Any way we can clean that up? 12, 11, 10, 9. Shot. Could be a little bit higher. Shot. Not bad, not bad. We're hitting the facet joint, which is okay. And at this point, I'm just going to back up and redirect. My goal is to get around the facet joint, but just barely. Shot. Shot. Not bad. Still looking good on the trajectory. Everything okay, guys? Yes. Shot. All right, we're lining up nicely on the lateral view. I feel we're still too medial, so I'm going to redirect again. Shot. Lateral view is still looking really good. Shot. Medial view is, yeah, looking good. Feeling good. Shot. AP. We're going to go take another picture. You always want to use front, back, side, side. So two views, front to back, side to side. Yeah, that's very nice. We call it AP and lateral. I'm looking at the lungs as well, making sure that we don't see anything bad happening there. like a pneumothorax. We don't want that. Is he doing all right? So far, we're almost ready for him to participate in his surgery. All right, it's getting there. Let's get another AP. So you can see we're passing the facet now into the foramen, and we're going to be at the back of the disc herniation in just a moment. I want to verify the level. Once again, count for us. 12, 11, 10, 9. So this is the 9-10 disc. All right, 9-10. Looking really good. Everything's looking good. Hopefully this is going to help the pain, which is what we expect. Now, our last patient is from India, and he waited 2 years for the surgery. This patient also waited 2 years. He told me. Shot? All right, one more AP. So far, it's looking really good. You can see the needle tip is lining up with the disc right where the herniation is. And I can actually feel a herniation with the tip of the needle right now. Well, that's perfect. Let's go back to a lateral view. 12. So there's L1, 12, 11, 10, 9. We are definitely at 9, 10, 10, 9, 9, 10. We're definitely on the right side. So we're doing everything right so far. All right. Is he almost ready for us, Dr. B?
How are you doing, my friend? You okay? Okay, we're going to ask you a question, all right?
Yeah, everything's going really good right now for you. I just need you awake for a minute, okay? How many of these surgeries have you watched? How many? Just give me a number. How many do you say?
How many do you think you watched? Oh, he's watched every single one.
Oh, wow. All right, so you've had this pain in your thoracic for how long? How many years? 8? All right, so 8 years. Are you ready for it to go away? I'm sure you are. All right. Are you comfortable right now?
He'll be in tears when this works.
Are you comfy?
Yeah.
As comfortable as you can be.
Hang on with you, buddy.
How bad is that on a scale of 1 to 10?
What's the number?
10? Is that where you get your pain? Good news, my friend. We found it. And we're going to fix that pain. That pain will be gone. You'll still have the facet pain, but that we'll get rid of next time. All right, great news. A really encouraging 10 out of 10 concordant. Concordant is our term for it. It is his typical pain that he gets every day. Let's get an AP view just to show the audience what the AP view looks like. You can see the lateral view. You can see a tear in the back of the disc. Let's show the AP view. All right, there's the dye. You can see it in the middle of the disc. All right, good. Go back to a lateral view, please. So at this point, we're going to have to make a decision. Are we going to use the larger scope or the smaller scope? And I think we're going to be using the larger scope. If I can get the larger scope, it's always better. If I can get it in, I'm going to try. Is he asleep or?
Still working.
All right.
Well, he's got bad CPAP.
Yeah, take your time. Just do it safe. Do it safe. Let's have some more num-num.
That's always.
Yeah, we'll do our best. Let me have some more num-num. So he told me he's been waiting 2 years to have this surgery. I'm giving you more numbing medicine. Just take it easy. Everything's good. This will hopefully make him feel a little bit better. You can see some of it's just coming out through the wound. Any questions from the audience?
At this moment, no current
Skin
questions.
knife. I think I got to connect the dots. We're close. All right, so now I'm going to remove the, where's the guide wire? Shot? We got to go a little more. Shot? There it is. All right, so we are in the T9-10 disc. Can you help me out here, please? Just a little pressure. And shot. I'm taking out the needle. I'm going to leave the guide wire. We've already done the stain on the disc, and we're going to place the dilator, which will get in there and spread the tissues. Okay? So just so you understand, we're not cutting him, we're spreading the tissues. It's like putting a pin, a little safety pin in your shirt. Shot in the lapel, right? You don't cut your shirt when you put a pin in. You just spread your cotton fibers with the pin. And when you're done with it, you remove it. Shot. And you remove the pin, and the shirt's still good. Shot. Because you haven't cut the fibers. I've given him a fair amount of numbing medicine. Shot. About as much as I can give him safely. I'm just slowly advancing the dilator down. Shot. That's it?
Yes, sir.
Shot. Remember, we're coming from the side. Shot. And again, the safety of the procedure is predicated on the fact that we place the needle initially properly. You know, we had him awake helping us, and I used good anatomical landmarks and good anatomy, knowing where the vital structures are. Pressure there and shot. All right, you ready? This is the more stimulating part. We'll go slow, nice and easy. Almost done. Dr. B, we're good. You can see we're already in the disc because he's relaxed. Yeah. And because he's relaxed, we're in the disc. And yeah. And I think this was the right choice, the larger scope. All right. You're doing good. Lay still. So sometimes the patients, I'll just wait a minute and put them a little more sleepy. Any questions?
Yes, we have two questions. This first one coming from Ping on Facebook.
Before we do that, I just want to make sure we did use the numbing medicine in the discogram material.
Yes, sir.
Take your time. Take your time. No rush. All right, go ahead, Henry.
Question from Ping on Facebook asking, how long for cervical do you have to wear the neck brace when you sleep?
6 weeks, Ping, 6 weeks. Think I should proceed? All right, that should be good. That's good. All right, you're good. 6 weeks.
Doing great, buddy.
Yeah, doing awesome.
Keep your arms.
Next question.
Next question coming from Cassie on Facebook
Cassie.
asking, would you recommend, what would you recommend for OPLL of the thoracic spine if you're not a candidate for DLDR?
Yeah, if you have OPLL, you have ossification of the posterior longitudinal ligament. Definitely not a candidate for that procedure for DLDR. But my question to you, Cassie, is what are the symptoms of the patient? Is it pain, or is it pain, or is it neurological like manifestations such as myelopathy? We'll be done in 10 minutes, Dr. B. If the answer is pain, then I think the OPLL is not the cause of your pain. There's something else going on. And if you ask me, the most likely cause is your facet joints. So what I would do if I were you is, if it is you or whoever the patient is, I would get a free MRI review, and there's a very high likelihood the symptoms are coming from the facet joint, not the disc. OPLL is generally a painless painless problem. Painless. Does not cause pain. So your pain is not coming from OPLL, coming from something else. Also, I want to know who diagnosed the OPLL and were they correct? The only way, huh? Yeah, everything's good. The only way to really diagnose OPLL is with a CAT scan. I hope there was a CT done and you could see it on the CAT scan. So my advice, do the Deuk Spine Institute for MRI review. Let me look at it, confirm you have OPLL. Let me see where your pain's coming from. If it's coming from your facet joints, which is the most likely cause, by the way, then it's fixable with our Deuk plasma rhizotomy. Takes literally 30 minutes and the pain's gone. Yeah, 5 minutes.
We have another question
I'll take the question.
coming from JG on YouTube,
Yep.
asking what part of the disc maintains, or what part of disc maintains disc height, and how is the disc height maintained during the healing process?
Yeah, so first of all, your disc height is not important. It's always exaggerated the importance. Okay? Disc height is not important. There are lots of people in the world, millions, with no disc height at all. They have totally collapsed disc. They have zero pain. They have zero dysfunction. They live a normal life. They're out there skiing the black diamonds, and they're riding BMX, they're riding motorcycles, and they're racing Formula One cars. They have no disc whatsoever. They have complete collapse. So the whole notion of disc height is nonsense. It's all just nonsense that's told to patients to get them to do reconstructive surgeries with interbody cages or devices. All right, but that said, what makes a disc height is the disc and the facet joints. And when you lose it, when you lose disc height, you're losing it at the disc and you're losing it at the facet. The facet is actually sliding downwards. We call it subluxation. And once that's done, the only way to get it to go back is to cut your facets out and to jack up the disc with a cage. And I've done more of that type of surgery than 99% of spine surgeons in the world. I used to do that all the time, every week. This is definitely the bad disc. You can see all the scar tissue, you can see the blue herniation, degenerated disc, and everything is going perfect for this guy. Could not be better. We're almost done. It's only one disc to fix. He's going to have a wonderful result. Deuk Spine Institute is the only center in the world that does these procedures on the thoracic disc. And we have people come from all over the world for this procedure. This patient came from South Carolina. Yeah. So he didn't have to travel across the world. But there's no one else in the United States doing this treatment. And these patients are told by their doctors to take pain pills. And that's the treatment. And learn to live with the pain. And basically give up on life. And a lot of them do. They just give up because they're told there's no cure. But it's not true. There is a cure. And we have the cure here at Deuk Spine Institute. Nobody else does. So don't expect to get it at your corner liquor store or Walmart or Amazon, because they don't have it. We do. So don't give up. Come find us. Save your money like these guys did. This patient and the last one saved their money for 2 years to have their surgeries done. Some of these surgeries may not be covered by your insurance. You know, we don't do surgery covered by insurance because it's covered by insurance. We do surgery because it works. And insurance companies, they don't like surgery that works because that means more people will want it and they're going to have to pay for more of it. And one thing insurance companies don't like is paying for medical care because that eats into their profits. Every time they pay a bill, they get less money at the end of the year for profit. United Healthcare Group was in the news again because they had this Change Healthcare subsidiary which was hacked by a group of hackers called the Black Cats. I think of Black Cats, right? And anyway, they extorted hundreds of millions of dollars from United Healthcare. For all I know, the Black Cats is owned by United Healthcare, and they extorted it from themselves as a way to basically take more money out of the healthcare system. They have very creative ways of doing it. Either way, the insurance companies are not your friends. They have one goal, and that is profit. And the way they make profit is by denying treatments. Denying treatment. So, long story short, this patient and the last one both saved their money for 2 years. And they came here after 2 years of waiting, and they're getting their backs fixed. Okay, this guy's 5 minutes from being done, and the last guy is getting ready to go home. Questions?
Yes. Next question coming from JG once more on YouTube, saying, "Thank you so much. Does this procedure work with a C6-7 slip disc with cord compression?"
Yes, it does. Yes, this procedure works for all disc problems. There are going to be a couple of patients that, basically 2 out of 100 that I cannot do this procedure for, but I can tell you whether or not I can do it based on your MRI. That's why we do a free MRI review. It allows me to tell you if it'll work, and if it won't, what's available for you if this won't work. But there's a 98% chance it's going to work. I just need to do an MRI review with you. All right, we are 1 minute away from being done, I think, here. Dr. B, any more questions?
At this moment, no current questions.
All right, so we're just about done. Again, he came all the way from South Carolina to Florida, and he's been suffering with this pain for 8 years. That's what he just told us. When I tested this disc with the discogram, he had 10 out of 10 pain. Okay, it hurt, and I could tell it hurt him because he almost came off the table. I saw him arch his back up. So even though he was kind of sleepy with the sedative, he still felt it. So I know we got the right spot. So I'm very happy about that. And this is pretty much the end of the disc. I just want to take another minute to make 100% sure I got it all. Grab her. And once I've gone in there and made sure, we'll be done. So if you have another question, feel free to ask it. Otherwise, we'll see you all next week. And he's going to go home tonight. Actually, he'll go back to his hotel. I think he's here with his wife. Hopefully she's watching and she can see everything's going really well for him. All right. Let me just clean one last part and we're done. Any more questions, Hen?
At this moment, no current questions.
All right. Well, there it is, the end of the disc. I'm happy with the results of the surgery. I think he's going to do really well. This is the last piece I need to get, and we're done. Let me have a grabber. I just want to tell everybody you guys did a great job this week. Thanks for getting these patients taken care of. Thanks for doing so amazing. And I don't know what next week looks like, but I'm hearing rumors that it's busy. So I just like to let you all know that I'll be out for another week. Nothing, I'm joking. I'm going to take next week off. You guys have Dr. Davis do all the surgery. Just kidding. I'll be here. I love work. I love coming here. I love helping people. I've said this many times before. I could have retired 10 years ago. And I come here because this is my purpose in life. Whoa, I got to suck it out. To help people get out of pain and eventually to teach other doctors, the dilator, how to do the same thing. So, you got a surgeon who loves helping people get out of pain. And I'll keep coming as long as I can, as long as God lets me. Scope use is a 5. All right. So everything was done through a 7mm incision, 7 millimeters. I'm going to put a staple in there in just a moment. And just for those of you not understanding, he's laying on his belly on a pad. His head is over there with the anesthesiologist. His butt is here, legs down there. And we did this whole disc repair at T9-T10 through a 7mm cut. I'm putting pressure on the muscle just because muscles can bleed sometimes and we don't want it to bleed. We want it to stop bleeding. And the way you stop muscles from bleeding is by putting pressure on them. I put in 3 staples because Luis likes taking staples out. And there you go. You guys see the incision there?
Yes, we do.
It's about 7 millimeters. All right, great job, everybody. Blood loss was like half a cc. And thank you, everyone. Great job today. And we'll go ahead and end this broadcast.